Hello everyone, welcome back to my YouTube channel. Today we are going to talk about frontal bone. Here you can see at the side the diagrammatic representation of skull, and the pink color bone just anterior to the skull is the frontal bone. So let's start our topic with introduction. Frontal bone is key component of skull that forms the forehead, the roof of the eye socket and part of nasal cavity. It plays a crucial role in protecting the brain, shaping facial features, and providing structural support for various anatomical functions. As a single bone, it contributes significantly to both cranial and facial anatomy. Now let's talk about the location of frontal bone. Frontal bone is located at the front of skull, extending from the upper portion of eye socket to the top of the head. Now let's talk about the structure of frontal bone. It is divided into two main regions. The first region is chemispar or forehead regions that forms the visible forehead and serve as an attachment site for facial muscle. The second region of frontal bone is orbital part that makes up the superior portion of the eye socket, contributing to the orbital protection. This bone also articulated with multiple cranial bones including parietal bone, as you can see in the diagram, sphenoid bone, ethmoid bone, nasal bone, maxilla and zygomatic bone. So these are all the articulations of frontal bones you need to know. Next we will talk about anatomical features of frontal bone. Frontal bone has several distinct features that contribute to its function. First is supraorbital foramen or notch, that is a small opening above each eye socket that allows nerves and blood vessels to pass. Second is the frontal sinuses are there that are basically air-filled cavities within the frontal bone that play a role in reducing skull weight and assisting in high voice resonance. Next, in anatomical feature we have is glabella, that is basically the smooth area between the eyebrows that is an important anatomical landmark. So next we have is coronal suture, that is a junction between frontal bone and parietal bone that forms the key structural boundary. Now let's talk about functions of frontal bone. Frontal bone serves several critical functions. They are brain protection, as it forms the anterior part of cranium, thus shielding the frontal lobe from injury. The second function is facial structural support, as it shapes the forehead and contributes to overall facial aesthetics. Next function is eye socket formation that provides structural integrity to superior portion of the orbit, thus protecting the eye. Next function is respiratory assistance, that as it contains frontal sinuses which help filter and humidify inhaled air. Next function is muscle attachment, as it serves as an anchor for facial muscle involved in expression and movements. Now let's talk about clinical significance of the frontal bone. In medical practice, the frontal bone is important in trauma assessment, surgical procedures, and diagnosing frontal sinus disorders. Features of frontal bone can affect vision, breathing, and neurological function, making its integrity crucial for overall health. Additional conditions such as sinusitis or frontal bone deformities may require medical interventions. Now let's talk about conclusion of our lecture video. Frontal bone is vital structure in human anatomy, contributing to cranial protection, facial aesthetics, and respiratory function. Its features, connection, and medical significance make it a fundamental component of skull. Understanding its anatomy is essential for both medical professionals and students of human biology. And this was all about frontal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.